Hello all, welcome to Is Pharmacology Difficult Weekend Classroom. Today on Saturday we're gonna cover the topics we did from last Thursday to this Thursday. I want to do it because next I will be starting a new topic, that is the elimination kinetics of drugs. So before we jump into the new one, let's give a quick revision of the main important points of this biotransformation of drugs or drug metabolism. The purpose of the weekend classroom is to revise, examine, and evaluate yourself. So what you have to do is to revise, evaluate, and examine yourself, how much you have revised and how much you know. Though I won't be covering the topics in details here. So the topics that I will be covering will be from last Thursday to this Thursday, and they involve the phases of the reactions of the chemical pathways that drugs go through. That is the phase 1 reaction and the phase 2 reaction. For that, you have to listen to my podcast on any of the apps, or you can visit directly on my website on www.ispharmacologydifficult.com. So on last Thursday, we did the phases of the drug reactions, and these were the phase 1 and phase 2 reactions. So first of all, let's talk about the phase 1 reactions in brief. The phase 1 reactions, they involved broadly oxidation, reduction, and hydrolysis reactions. Now, there was many types of oxidation reactions. The main were the microsomal oxidations and the non-microsomal oxidations. Microsomal oxidations can be aromatic or aliphatic hydroxylations. They can be nitrogen, oxygen, sulfur dealkylation. They can be nitrogen, sulfur oxidations. Then we have non-microsomal oxidations. They can be cytoplasmic oxidations, or they can be occurring in plasma. Then they will be known as plasma oxidations. Reductions can be again microsomal and non-microsomal. The microsomal reductions, they involve the azo reductions, keto reductions, nitro reductions. And then the other ones are the non-microsomal reductions. For examples, I've covered in detail in my podcast episode, so you can refer to that, or you can listen to that on any of the apps available. Then next, I have hydrolysis. Again, they can be microsomal, they can be non-microsomal. One good example of microsomal hydrolysis is the conversion of pethidine to pethidinic acid. And non-microsomal hydrolysis is for the class amidases. Now let's talk about the phase 2 reactions. They are very few, but they are worth talking. The most important one is the conjugation reaction. The microsomal conjugation is the glucuronide conjugation. It is the solo example, and because it is solo example, it becomes very important to study. Original drug compounds, they possess some reactive groups, which can be alcoholic, phenolic, carboxylic. They undergo the reaction, they form glucuronide drug conjugates. And these glucuronide drug conjugates, they are easily excreted out. The next I want to talk about is the non-microsomal conjugations. The most important one occurring in the cytosol is the N-acetyl conjugation. The enzyme used is the N-acetyl transferase. Then we have sulfate conjugation. It also occurs in the cytosol. The enzyme involved is the sulfotransferases. Then we have amino acid conjugations, and we have methyl conjugations, glutathione conjugation, which is very important one. The enzyme involved is the glutathione transferase. Now that is all about the phases of the drug reactions. Now let's come to the topic that we did on Sunday. On Sunday, I talked about the enzyme induction and the enzyme inhibition in a comparative tabular form. So I will be jotting down the most important bullet points for each of the enzyme induction and the enzyme inhibition today. First of all comes the definition of enzyme induction. Enhancement of the activity of the enzyme, which finally spikes up or accelerates the metabolic process, which leads to the diminution of the drug activity. That is combinedly the process of the enzyme induction. And reverse is true for enzyme inhibition. Now let's know the site of the enzyme induction. It is prominently the liver, and it can occur in lung, kidney, plasma, etc. The basic mechanism of enzyme induction, it involves the protein production. And this process takes a long time. It takes around weeks. And because it takes up a long time to build up, it takes a long time to go away. So the whole thing is quite a long process. Now let's get to know the important features of the enzyme induction. First of all, what can be the consequences of enzyme induction? They are decreased plasma levels, the decreased activity of the drug because its metabolism is enhanced. Some important enzyme inducers, they are the barbiturates, the phenytoin, rifampicin. If they are used with oral contraceptive, then it may result in the failure of the contraception. If they are used with anticoagulants, then bleeding chances increases. Sometimes self-induction of the metabolism occurs, and that is given a special term of pharmacokinetic tolerance, that is an adverse effect of barbiturates. And then I've given many more examples. For details, again, I would say please refer to the podcast. Now let's get to know the clinical benefits or how clinically we can utilize this process. The most important clinical use is to treat the jaundice in the newborn. For that, we use phenobarbital. And the whole process is discussed in the podcast episode. Please listen to that. Now let's come to the definition of the enzyme inhibition. Decrease of the enzyme activity and decreased metabolism, finally leading to increased plasma levels of the drug and increased activity of the drug. It may also lead to finally toxicity of the drug. And this whole process is combinedly referred to as the enzyme inhibition. Now, some important enzyme inhibitors are cimetidine, ketoconazole, theophylline, etc. And accordingly, I've given a lot of examples in the episode of what effects can be seen when they inhibit the object drug. It may lead to finally the increased activity or the toxicity of the object drug. Now, the clinically they can be used, especially I want to talk about in the aversion of the alcoholic addiction. That is the first important use. Secondly, the combination of L-DOPA and carbidopa is used for the treatment and effective treatment of Parkinsonism. Then before I ended the topic on Sunday, I also gave a word about the hepatic metabolism. That some drugs, they are dependent upon the hepatic blood flow for their metabolism. And most prominent among these are the propranolol. Other drugs are morphine, etc. Now coming over to the topic that we talked this Thursday, and that was the factors affecting the biotransformation of drugs or the drug metabolism. In that I covered many factors. Some were primarily affecting the drug metabolism process, and the others, they were not importantly affecting the drug metabolism process. Now, the factors affecting the drug metabolism, the first important one is the age, and especially in this also I talked about the extremes of the ages, like the neonates and the elderly people. So they are the tender ages, they are the fragile ages which you should take care of, and in detail you can refer to the podcast episode. Next, I talked about some unimportant factors which are not much proven or of much having proof in the human beings, but they are seen importantly in few of the animal species, and they are the sex. And next important one is the species. As far as the races is concerned, there is a difference seen in the Chinese continental races and in the Indian races. Then most important factor affecting the drug biotransformation is the genetic variations. In that I gave you few of the examples, especially I gave you about the genetic polymorphism seen in the metabolism of succinylcholine that leads to prolonged apnea. Then as far as acetylation is concerned, a person can be a fast acetylator, a person can be a slow acetylator, and accordingly we can see the consequences of hepatotoxicity or peripheral neuropathy. And then there is genetic variation affecting the metabolism of codeine. Next, I talked about the diet. The main factor was the inclusion or the exclusion of the protein. If the diet is protein rich, it accelerates the metabolism. If it is poor in protein, as is rich in carbohydrates, it slows down the metabolism. Then I talked about the factor drug-drug interactions. In that, we have to take into consideration the one we started in the last episode, that is the enzyme inhibition and the enzyme induction process. That leads to a lot of drug-drug interactions, and ultimately it leads to the slowing down or the acceleration of the metabolism. And the last important factor that I discussed is the disease or pathology. There are a lot many diseases that adversely affects the drug metabolism, like liver cirrhosis, then viral hepatitis, then hepatocellular carcinoma, and then thyroid disorders, hypothyroidism, hyperthyroidism, all affects adversely the drug metabolism. So these were the important factors, and by covering the important factors, I finally say the end to the topic of the drug biotransformation. Yes, we have done it all, and I have today covered in this weekend classroom a lot many important points of the drug metabolism. I hope you liked it. In case you liked it, please hit the like button. And next onwards, the episode, we'll be starting off with the elimination kinetics. That is a totally new aspect of the pharmacokinetics. I think that's the last point of the pharmacokinetics. And by finishing that, we'll be winding up with the pharmacokinetics also. So that's a great news. So in the end, I would just like to say, for all the updates and latest episodes, please visit my website www.ispharmacologydifficult.com. You can subscribe for the monthly e-newsletter. It's totally free. It contains a lot of medicinal updates, drug information updates, my podcast updates, and you can listen whatever platform you listen to to my episodes. You can just follow and subscribe. You can leave a review on iTunes, Apple Podcast. In the end, stay tuned. Do subscribe my YouTube channel. Stay safe, stay happy, stay enlightened. Thank you.